5:31, we'll call the meeting of the Ayer Board of Health to order for Monday, December 13th, 2021. And due to the ongoing COVID-19 pandemic, in accordance with Chapter 20 of the Acts of 2021, suspending certain provisions of the open meeting law, public bodies otherwise governed by the open meeting law are temporarily relieved from the requirement that meetings be held in public places, open and physically accessible to the public, so long as measures are taken to ensure public access to the body's deliberations through adequate alternative means. This meeting will be live on Zoom. The public may participate remotely by joining Zoom meeting ID number 880-9915-1478 or by calling 301-715-8592. For additional information about remote participation, please contact Heather Hampson, Administrative Coordinator at hhampson@airmass.us or 978-772-8220 extension 145 prior to the meeting. The first item on the agenda tonight is consideration of going to executive session. What is the pleasure of the board?
I will make a motion that we enter executive session pursuant to Mass General Law, Chapter 30A, Section 21A, Exemption number 3, to discuss litigation strategy with respect to the case of Mimi's Place LLC versus Board of Health of the Town of Ayer et al., Middlesex Superior Court, CA 2181 CV 4967. If discussing the matter in open session will have a detrimental effect on the town's litigating position, and the chair so declares.
The chair does so declare. Is there a second to the motion?
I second.
Motion's been made and seconded. All those in favor, Ms. Papineau,
Aye.
Ms. Peters,
Aye.
and Mr. Slarski, aye. So the board will enter into executive session only to adjourn to go back into open session. The Ayer Board of Health is now in open session, having come out of our executive session. And the first item on the agenda is public input. Is there any comments from anyone in the public? Going, gone. Hearing none, we'll move on to the review of the solid waste trash haulers regulations. Is that, Pam, something that's fairly quick, or is that something that's going to take time?
It's going to be super quick because
Okay.
I have not connected with Bridget yet, and I was slow getting the documents over to the DPW to review. So they've only had them for, I think it's like 2 weeks now. It hasn't been a long time that they've had them to review, and I didn't really put any time limit on them, but all I asked them to do was to just, I told them how the concern arose to begin with, that, we had some, just had some public input that we could probably maximize our recycling rewards. So gave him the breakdown that I had done of where I thought we had things covered, and just asked him for his input and edits and comments, and that's it.
Okay, so we'll put this on the agenda for the next meeting as well then.
Yep.
If there's need. Okay.
Yeah, because I think as soon as we get input back from them, we can talk about what the board wants to do, if anything, and then we can also get Bridget's, we can kind of run in parallel with Bridget's input.
Sure. So that being said, then let's move on to meeting Jenna. Jenna, welcome aboard.
Hi, thanks so much. Yeah, it's really good to be here. I've gotten to know Heather pretty well in the past couple weeks, but the rest of you I have not gotten to know. So I just wanted to pop in and say hello. Keep it pretty brief, but share a little bit about what I've been doing at Neshoba so far and what I'm hoping to continue to be doing.
That'd be great.
That being said, shameless plug for my Neshoba Associated Boards of Health communications survey that I sent out in October. It's anonymous, so I don't get to know who has and has not answered it, which means I just get to go and throw it out there in every Board of Health meeting I go to. If you have not done it, if you could please, that would be great. And I am happy to send you the link again. The reason I asked for that. Oh, sorry, go ahead.
I've seen it. I don't know that I've seen it.
Okay, yeah, I'll send it out again.
Yeah, please.
Yep. Would it be best if I sent it through Heather?
Sure.
That's always, yeah, that's always a good idea.
Great. Alrighty, I can do that. So that's more, it's, you know, the stuff that I would be generally chatting with you guys about anyways, but having it show up in the survey, I can go to Jim and Tamara and say, look, I have data driving the decisions that I'm making about where I'm taking things. So
Sure.
It's helpful, and it allows you guys to kind of have a voice in the process. So that being said, with the responses I've collected so far from board members and administrators, I'm working on a COVID-19 page for the Neshoba website that I'm going to try to update at least once a week, just go through, make sure all the links are active. But the idea of having this page is, with the vast amount of information that is out there through Mass Department of Public Health, CDC, and everything, I know that the lay person can get a little overwhelmed with all that, and it can be hard to find the information that you're looking for. So I'm trying to condense it all in one place, keep it up to speed. And then if people get to the very bottom of it, they don't get a cookie, but my contact info is there kind of saying like, hey, if you know, you still have questions after looking at all this, feel free to reach out to me. So, and I'm just trying to keep myself up to date with all the research and data that's out there. Trying to get text messaging going for our contact tracing and case investigation efforts, because that's going to allow us to reach more people quicker. And then working on getting our social media up to speed. Also working on getting the whole entire website overhauled so that it's a little bit easier to navigate. But in terms of the COVID-19 page, if that was something, you know, I've been throwing this out there for all the boards. If you want to link to our page and just know that it's going to be updated like at least once a week with current information for your townspeople, then absolutely feel free.
I think that's a great idea.
Yeah, and I'll let you know once it's up and running. We have to, you know, go through our website vendor and everything. There's a few different steps to get it live. So,
okay.
And then working on with some other towns, like I've worked with Libby and Harvard on a few communications for Harvard, a communication for Lunenburg, all this about different aspects of COVID-19, contact tracing, quarantine, isolation, etc. And I've been putting together those weekly reports you guys might be getting from Jim on the COVID-19 numbers as well. So those are a few of the things I've been doing. My background is clinical social work. I'm an LCSW. And you know, so I've been bringing kind of a social determinants of health lens to this position, which is important anyways. The grant money that I was, that my position was funded with is really looking for that. So trying to incorporate that a little bit, based on survey responses I've gotten so far, my own observations in the community, being on a few different coalitions and stuff, it seems like mental health and substance abuse are a couple things that maybe are under-addressed in our overall 16 town area. And it's something I'm very passionate about. So looking to find different ways to get more of those services available to people in the towns that we serve. So to that end, I'm working with the Healing Community Study out of Boston Medical Center. They're working in Shirley and Townsend, also open to working with surrounding towns. They've got some funding. They're helping us put some specific steps into place to hopefully reduce the opioid overdose death rate by 40% in a 3-year period. In those 2 towns and others. They're actually working in 4 different states and several communities to see what interventions really work for this stuff. So
interesting.
Yep. So we're looking to put a drop-in center in Townsend. I'm in communication with AIDS Project Worcester to try to get a mobile van up into some of our towns if they want it. It's totally free to them for, you know, they'll do hepatitis and AIDS testing. They have like a phlebotomy chair for other things. They'll do STD testing. They even can have like a housing person come along and talk to people about housing referrals. Yeah, so ways to get that stuff into what's otherwise a little bit of a resource desert in terms of those things. So
Interesting.
Yeah.
that's
Right.
like my little pet project for the time being anyways. So that's kind of it's like all that and more is my position. So
Welcome
Are you
aboard.
working on only COVID related projects, or do you have a broader scope than that?
oh, broader than that. Yeah. I mean,
Okay.
it's tough because as you guys absolutely know, COVID is kind of at the forefront of most people's vision at this point in time.
Yeah.
And with the CTC dissolving, the contact tracing collaborative, really working with our public health nurses and contact tracers to get some communication up and running that supports them with this like influx of
Right.
contact tracing and stuff that they're now having to deal with. So at the moment, I am prioritizing that.
Well, it is taking all the oxygen out of the room right now, literally. So,
Yeah.
But that's good to know. I like the fact that you have a mental health background, because that's been a concern is there adequate access to mental health resources because of COVID and just because of everything associated with it. Is
Yep.
there anything we as a Board of Health could do, to provide resources, or not really, I mean, we don't have a lot of resources. We have a small budget, but information resources, I guess, is what I'm saying.
Right. And part of my job can be interfacing with our towns to let them know about resources. So one thing I've learned about being a part of the Healing Communities study is that there is a new provider of Suboxone, Sublocade, and Vivitrol in Groton, Mass now, which
When you
is
say
wonderful.
a new provider, you're talking about a medical person that can write for that, or?
Yes. So it's
Okay.
actually not someone who's like new to the field. They're new in Groton, but they're from Emerson's addiction medicine program, Dr. Stephanie Strategos.
Okay.
And so she's the one who's doing, it's at least one day a week, maybe a little bit more in Groton, Mass at a clinic, which makes those services more accessible to people in this area.
Yeah.
So.
Yeah.
Because by law, you have to have a certain license to prescribe those drugs. You can't do it as a general practitioner.
Yeah.
Correct.
I
Yes.
remember when we did the opioid forum a couple of years ago, Pam, when we tried to, it didn't take off, but there was a physician that came to it and spoke. And I believe at that time, he was one of the only ones that was prescribing it. And like you said, it wasn't a full-time person.
Yeah.
And that was what, maybe 3 years ago?
I would say about 3 years ago.
Yeah.
And I thought that was really good. I mean, we kind of facilitated a forum with different speakers on the opioid issue, and Trish really put it together and did a great job. And that's something that we'd be open to, helping to put together or organize, whether it's opioids or if it's more mental health related or other health issues. We're really open to that.
Yeah.
Excellent. That's good to know. Yeah, I will certainly keep you guys abreast of any developments with those things then.
Well, hopefully we can meet in person in the very near future, and we're not doing this over a Zoom platform, but
that would be nice.
No.
But welcome aboard, and we look forward to working with you.
Thank you.
Thank you so much. Pleasure to meet you all. Have a good rest of your evening.
Thanks,
You too. Thanks.
Bye.
I'm not sure Bridget's on board tonight, is she?
I don't think she is.
I don't think
Yeah,
she
no,
is.
Bridget's not going to be here tonight.
Okay.
She is not.
So under the COVID-19, the report that Jim had sent out last week showed the area being, or the whole area being way above the Middlesex County level of positivity. I don't know if you had a chance to look at that or not, but it certainly hasn't slowed down the transmission.
Right.
And my understanding is that it's mainly unvaccinated, and a lot of it's being brought home from kids to unvaccinated parents.
Yeah.
I know in Maine, in the state of Maine, they've called out the National Guard because the system is overwhelmed. Yeah, so,
Oh, my God.
yep.
Providing treatment? You mean?
Providing treatment and backing up the providers, because I guess the providers are getting burnt out and just calling it quits, you know?
They, absolutely, yeah.
Yeah, and today,
I understand.
Governor Baker, there was a list that they put out of the communities that are eligible for the testing packets. Ayer isn't on the list.
Mhm.
But they were sending them out to all these underserved communities to self-test. And you got to start somewhere.
And the only
Yeah.
hassle with the hassle with the home test, Trish, is the false positives.
Right,
If you get a false positive, then you have to have a PCR test to
right.
confirm whether or not it was positive or not.
Yep,
So that's a hassle with that. But
yeah.
it is what it is. So
Yeah.
if we don't have Bridget, is there any other conversation regarding COVID? I mean, I know we're still doing clinics.
Mhm.
My daughter has volunteered and she's been at a half a dozen so far doing administration. So
That's
Yeah.
awesome.
Wow.
I love
and
it.
her comments are she thinks they're very well run. They're very receptive. I guess
Good.
kids have been a challenge because a lot of kids don't,
Oh,
the parents want them to get a vaccination, the kids don't want it. So
It's
My
no-
kids got theirs last Thursday at one of the clinics in Shirley.
really, that's great.
Yep.
That's great.
Good.
yeah.
And I guess we'll hold off on anything further on the show, but then I have nothing new unless either one of you do, but there's
Yeah.
nothing new that I'm aware of
No.
regarding the Shoba.
No.
Okay.
Unless, did she give you any information, Heather? Did
I
you
have-
get any reports right now?
I haven't seen anything.
Okay.
Heather, have you seen anything or?
No, Bridget was out today, so she didn't come to the office and bring anything over, and she didn't bring anything with her last week. So I don't have
Okay.
anything from her.
Okay.
Okay.
If you can catch up with her, Heather, maybe tomorrow and just see if there's updated information that you can distribute to the board, that would be great.
I can do that.
Thank
Cool.
you.
Yeah, I heard today might be a special day for Bridget. so
Yeah.
without conveying it to the public, we'll just leave it at that.
Yeah.
Yeah. What I
we-
guess the one question that I had on that, Steve, was I noticed that in Heather's call log, there were several calls in the last couple of weeks that
Yep.
were referred to Neshoba for positive COVID results. But yet I understand that the contact tracing resources really that were available are no longer available at that level. So I was kind of wondering how Neshoba's doing with that, and what's the situation? Are they totally overwhelmed again? Are they trying to do all the contact tracing themselves? Are there like reduced requirements for contact tracing at this point? I'm just not that well tied in with what's going on for contact tracing.
I wish I could tell you that I knew more than that.
Oh,
and
yeah.
I think the whole contact tracing has been difficult because people, if they do a home test, they're not upfront in terms of saying that
Yeah.
they're positive. It's just not
Yeah,
happening. So,
exactly. Yeah.
I don't know what percentage, the capture rate is. And I don't know.
Yeah.
Yeah,
But-
I remember Bridget had said that at the last meeting, that the contact tracing is totally different than it was during the first round. People are just,
Yeah. Yeah.
they're not being as honest as they were, or accurate as they were, so.
So with that in mind, the minutes from November 22nd, there
Okay.
were some sentences that I had a hard time. I think there might have been some grammatical questions that I had, but nothing on content that I saw that was
No,
not accurate.
I would agree with that. I think content wise, it's
Is there a motion to accept the
I-
minutes?
sure. I will move that we approve the minutes of the November 22nd meeting.
Is there a second?
Second that.
Motion's made and seconded. Any discussion? Hearing none. All those in favor?
Aye.
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 And we'll
Um,
come down and,
Yeah, well, I'll bring a signed copy down to the office tomorrow morning, and then if you guys can stop by when you have the time and sign it.
okay,
Does that work?
works.
Okay.
for
Yeah,
me.
yeah, I will.
Okay.
The one day I went to town hall to get the computer and sign a whole bunch of minutes was the half day.
Yeah, Heather wasn't there.
That happened to me too, Pam. I went down to see Heather and sign, and there was a sign on the door. It's my fault. I should have checked. And I wanted to talk to her about the dates for next year, for the upcoming year. And then I thought I sent them to all of you and I didn't. So I will do that. I had, and we'll talk about that at the end before we sign out for action items. But yeah, I had the same.
Well,
same
Heather was there. I got my minutes signed. I just didn't get the computer because that was
Okay.
the one day that Cindy had.
I wasn't
had
there.
to
I
leave it.
know, I'm sorry.
Yeah, I know. It was like of all the days.
Of
So-
all the days, I know. I
think
still
I'm
have
gonna
it.
I think, Cindy, I'm gonna shoot for next week because I'm off of work next.
Okay, that works. We could meet up somewhere or whatever. We'll get it
No,
done.
no, I can come in. It's just a matter of I end up with these days that have either calls that are scattered around or later in the week, I'm out of the office for a couple days to do, at clients. So
I
it's
hear
just-
you. Yeah.
things will be a little calmer next week, I hope.
Yeah, maybe. I'm hoping
Yeah,
for that
maybe.
myself.
Yep. So,
All right.
So moving on to administrative matters, how much time do we have left? We have about
Plenty.
15 minutes. Yeah, so we got time. The budget for next year. How did you folks handle this in the past and how do you want to handle it this year?
I think what we've done just about every time in the past is to, just have the chair take a look at it and see a lot of things we've traditionally level funded, and unless we foresee, an increased need and can justify that. So if you do a first pass, when does it have to be finalized?
It's not until January, but it looks like it's the end of December is the date that they're asking for initial input.
Yeah.
And then
deadline.
there's going to be a meeting of the selectmen, department heads and committees.
Okay.
I don't have it in front of me, the date that is, but it's not for a while and it looked like a January timeframe. So
So the memo that I sent you all from Robert states that if they don't receive, if the finance department doesn't receive anything from the board by December 30th, they're
Right.
going with last year's budget,
okay,
no matter what.
Yeah. Yeah, because this is our request. If I remember from previous years, this is where we say what we want. If
Okay.
there's no discussion or we don't need to justify anything, then I don't think we even need to attend that meeting.
Right.
I only did once when we wanted an increase in one line item for, I don't remember what now.
well,
But
how did Neshoba present their budget for the town to accept? How does that process work? Does Neshoba, because I've got nothing from Neshoba in terms of what the projections are for next year.
you don't have to do Neshoba. That goes,
Okay.
that's an assessment. So that goes directly from, I know, it's a line item under our budget, but we can't control it and we don't negotiate it.
Okay, how about the secretary's wages?
Yeah, same thing. That's a contract issue. So it's just the discretionary stuff like pencils and paper and,
Right,
equipment and that kind of stuff.
which it's pretty standard.
I had mentioned to Pam today, Trish, I would like to see money for educational support for the members of the Board of Health. If we want to go to a seminar, to the whatever, that, we would have the money to, register and to attend. I think that's important that we stay abreast of what's going on.
Okay.
So
And-
Steve, that
Yeah.
money would come out of the line item that says services that's budgeted $1,000.
Okay, that, I don't think that's sufficient, but I would like to see it at least $500 per member to attend something. Maybe we won't use it, but have the ability to do it if we want to. And I think it would be important, and I think it's a small.
It's reasonable.
Okay, so
Yeah.
I guess I would shoot for $1,000 per person or $3,000 total, and maybe back off to $500 per person or $1,500 for meetings or whatever. So
Yeah.
that, because I think it's important that we stay in tune with what other communities are doing.
Yeah.
And you can't do that in a vacuum. I think it's important to be part of,
Sure.
We used to attend the Mass Municipal Association. The MMA had seminars that they would put on in terms of public health. So
Hmm.
I'll try to get information together, but we'll try to increase the budget by a dollar amount that allows each of us to attend at least one meeting during the year.
That would be nice.
So
Okay.
how do we do that with the date being the 30th? How do we do that? We don't have much.
I'll submit a change in terms of the sheet that Heather gave me, or an increase in the appropriation is what we're requesting.
Okay.
Okay. And it will be before December 30th.
Yeah.
That'd
Well,
be-
I never thought of that, Steve. But you're right with it's not just about COVID, with all of the other things that Jenna had brought up. Yeah,
Yes.
I think we need to know a little bit more about, we shouldn't be kept in the dark, and we should know what the language is and what they're, just what they're talking about and what it all means.
Well, Trish, the PFAS thing is going to be, in my opinion, the next asbestos issue.
Mhm.
It's huge, and
Yeah.
it's overwhelming. I know a little bit about it because I've got a background in chemistry, but I certainly don't have a clue what
Right.
the steps are and where this whole thing is headed. And, I would have a specific interest in being better educated in that.
And
So-
I think with it coming, pretty soon, that they're gonna have the storefront, whatever you call it, an office.
Yeah, for
That
the.
if people come up to us and ask us about it, that we need to have some kind of background knowledge about it, not,
Yep.
that we
Yeah.
can relay to people. So, yep, true.
Yeah.
Okay, so we'll try to do that for the budget. And
The only other budget suggestion that I could make, and the problem is I don't even know what amount would be appropriate. So maybe it's something we look at for next year's budget. And that's getting some consulting time under those services from perhaps
point.
Rich Doherty, who is the independent consultant that works for PACE. He's
Yep.
grant funded, working for PACE. He is, and I'm curious to get your take on this too, Trish, but he, at every RAB meeting I've ever attended, he has just knocked my socks off, that he is right on top of this stuff.
Right,
He
right.
gets it. He's able to ask the right technical questions. He remembers from one RAB to another what's going on. Well, what was going on with this monitoring well? And that monitoring
Yeah.
well, and it's really it's just information that would be hard for us. It's a level of competence, I think, that would be hard for us to acquire.
Pam, is there some way you can find out what that relationship might be? And then are you suggesting maybe you attend the Board of Health meeting once a month or something like that for an update from him?
No, I guess what I'm thinking is
You go through Lori.
yeah, I would
Lori?
go through Lori, and what happens now is the RAB documentation, whether it's an update or it's a proposed action, those documents go out to all of the people that are on the RAB contact list. And a lot of times we're asked to make some either, you can add your official comments or responses. I did it a few times in the beginning, and it's something that it's very detailed and very technical. I find it very interesting, but it's something that you really have to be able to devote the time to dig into it and to do it justice, I think, from a Board of Health perspective. So I was kind of looking at a way that we could perhaps, and I think Rich is probably the appropriate guy because we've seen him in action. We know that he has a good grasp of what's going on here. He already knows the project. I'm looking at ways that perhaps we could tie his review into Board of Health recommendations so that we are able to put we're able to sort of sign our name off as well to his recommendations because we feel that they're representing us.
Okay.
Now, we would have to work out with Pace how that arrangement would work officially, and even, I guess, with the town. So it might be a premature thought, but.
Well,
Pam, what are his, I can't remember his title.
He's an independent consultant, and I can't remember if he is a geologist or
Rich, what was his last name? Do you remember?
Doherty.
Doherty, okay.
And I don't recall if he's an engineer or a geologist. I'm looking to see if I have any info on that.
But yeah, I think that would be something to look into coming up. That would go hand in hand with what Steve said about better education about the PFAS. If we knew more about the PFAS, then we could talk to Rich and get a better understanding of the root, the root causes.
Yeah, and maybe the format that it takes is just some time for him to, perhaps on like the RAB meetings tend to be quarterly. So when there's an upcoming RAB meeting or documents that have been issued for review, for him to be able to give us kind of an information download, to explain it to us in a way that we can understand it. And if there are recommendations to be made, we could join in those recommendations in return.
Would you talk to him directly to see what type of either relationship or, how he would work with us doing that? Can you find that out?
Yeah, I think what I would maybe do is speak with Laurie first, which I can certainly do.
Yeah.
And kind of get her lead on it first. The other piece of it, maybe if I do that part of it with Laurie and Rich, you could look into how does it work from the town's perspective? Because I'm sure it's different if he's advising an elected town board rather than a volunteer organization.
Well, yeah, I think from the authority perspective, the authority falls under us.
Yes, right.
And anything else would be advisory or information in terms of taking action. So I think it's a great point. If you talk to her, I can run it by Robert, but I think we have the authority to request information and to act upon it as long as we have the skills to do that,
Yeah, I agree with you. It seems to fall under that if we need to have, sort of expert assistance in executing our duties, then that should somehow be available to us. And it seems like we've got a tailor-made asset here.
Can you, if you can do that by the 30th, at least get some understanding. Would there be any expenses related to doing that? We can plug it into the budget as well. But I think it's,
I will
the-
send you an email. I'll just talk to Laurie and,
Okay.
ask her what she would envision for the upcoming year, and then
Yeah.
I'll
I
email
think
you.
I think it's a really good point, well taken, and it's part of what I was kind of suggesting from the education perspective,
Right.
to keep us up to speed and current.
Yeah,
He may be a great resource. Okay,
yeah,
Great.
and to make our input more
Yes.
valuable. I'm really feeling badly about our role with the whole, Devon's RAB, because we don't have anyone right now with the wherewithal and the resources to dig into it at that level.
I know,
I
and
think-
we've been relying on Lori for a lot of it. But, the information, and when we did attend, you better than I understood it. I thought it was dry as toast, and trying to read those, looking at those overheads, they were like so small, and
I
all
know.
highlighted in red, and this number, and so many trillions, and I'm like, ugh.
That was always a
Yeah.
challenge. You're right.
Yeah. So
I don't
that's
want to be
great.
I don't want to be a naysayer. We're down to 2 minutes left.
Okay,
less
let's
than 2
go.
minutes.
Okay,
Okay.
go.
All right, I'll get some
All
info.
right.
I'll send you an email.
Okay. Is there any bills or mail, Heather?
I believe the only bill I have, is for Neshoba for
Okay.
their quarterly bill.
Okay.
So when you come in to sign those tobacco permits for me, I can have you sign that so that I can get to accounting this week.
That will be tomorrow. You're in
Yes.
all day tomorrow?
I am in all day tomorrow. I have a planning board meeting. I'll be there until probably 8 o'clock.
I'm not coming in that late. I'll probably be
Oh,
there
God.
around, I would say noontime or very early afternoon I'll be in.
Okay.
Okay, cool.
Steve, I just wanted to ask you quickly if you and Pam, what did you have for the next possible date, January 2022? I thought I sent you something, but I guess I didn't. I thought when I looked at the calendar, how it was every other week, how Mary had always done it, I came up with January 10th.
Oh, would help if I looked at the right year. Yeah, because the 17th is the holiday, right? So we can do the 2nd and the 4th.
Correct.
Monday, which would be the 10th and the 24th of January.
Okay. Does that work for you guys? And I'll send you the other ones that I came up.
Yeah.
They're just possible dates, and then you can look at them.
So the
And
10th and the 24th for January?
Yes, does
Yeah.
that look great?
Yeah, I think that works.
Okay,
Yeah, that would be good.
okay,
Unless we need to meet
yeah,
sooner
Yep.
because of
Right, yeah.
litigation.
exactly, yeah,
But if we do need to meet sooner, maybe we can just, if we have to post a special session, we'll do that before then. And
Okay.
hey, Heather, real quick, is there any time frame for going back to in-person meetings yet from the town?
I think when the selectmen voted on it, it was through March.
Okay, my understanding is that depending on numbers, that might change, but right now it doesn't look like the numbers are looking.
Yeah, I don't
Right.
think that's gonna
Yeah.
change
Terrific.
anytime soon.
Yeah,
Okay,
good point.
all right.
well, with that in mind, happy holidays, folks.
Yeah, you too.
Yeah, and if there's anything new, I'll communicate with you
Please,
regarding the litigation.
okay.
Okay,
Okay,
that sounds good.
we have a motion to adjourn.
Oh, yeah. I'll move that we adjourn. Let's adjourn.
Is there a second?
I second it.
Okay, motion's made and seconded to adjourn the meeting of the Board of Health on time at 6:30 as requested. Any discussion? Hearing none, all those in favor?
Aye.
Aye.
Aye, okay. Well, thank you very much.